have these anxious attacks that you call them.
Yeah.
About maybe, we'll say like, how often are you getting the anxious attacks at this point?
At this point,
Mm-hmm.
I would say, I know it sounds really vague, I'm sorry, but it's like once or twice, maybe every couple of days. So sometimes it's just it's more like sporadic. It's not, you know. That's why to me it's not normal. Like, it's one of those things that it's like, it could be like Monday and I'll have like a little attack, and then Tuesday I won't, and then Wednesday and Thursday I won't, and then like Friday I won't, and then it's like this vicious cycle. I just feel so discouraged, really.
So a few times a week, and so I know you told me about maybe about twice a week you do take a Xanax. Is this at the same time that you're having anxious attacks, or
Yes.
are they okay?
Yes.
And does it immediately make you feel better afterwards?
I would say so. Maybe like an hour. Give it an hour.
Okay. Okay. So, if you're not taking the Xanax, what do you do to kind of calm yourself down, or what do you do to feel better after your anxious attacks? Is
I
that when
have
you
to
start?
check. Yeah, I've got to check. I got to start checking.
Okay, and that does make you feel better.
Yeah, I mean, the lump could literally just show itself. I mean, that sounds silly, but like literally, I feel like if the pain is there, then it'll be easier for me to find something.
Okay. So your overall, how would you describe just your overall mood throughout the week? You know, just if you can just describe it to me, or if you can find the words, what would you describe your overall mood throughout a week as?
Just anxious, stress.
Anxious, stress.
Yeah.
Your doctor, so I believe that your
Yeah.
stress levels
All
are
the
higher.
all the cases I see, they're just crazy. So yeah, definitely anxious and stressed. Sometimes I'm just complacent, so to speak, when I'm just like with my kid, which is like on Saturdays and Sundays when I have more time to spend with him. Like, I feel more complacent then, but sometimes the anxiety will strike again, knowing that there's gonna be another case, and it's just gonna be something bizarre that could happen to anyone, and it's like
It sounds
vicious
exhausting.
cycle.
Your
Yeah.
workload, plus, you know, your family at home, and plus this, you know, this looming feeling of, you know, being sick and checking yourself. You still have to find time to do that, so.
Yeah, my wife gets really pissed.
Okay, and tell me more about your wife.
Well, she just has been really mad lately. She's a, she's a great woman, you know. She's a nurse, and you know, she sort of just notices that I tend to freak out over just the littlest things, and just the littlest things about my health, like. And she's like, "Why do you keep checking yourself? Like, you didn't work this hard just to be this unhappy." She says that all the time, and she's right, but I can't help but check for something wrong, because I'm not going to give her the satisfaction of being wrong at the cost of my health. Like, if I find something there, then I'm going to be like, "I told you so." Like, there was something wrong. Like, stop just trying to calm me down just because you're sick of hearing about it. You know, we've been married for 10 years. You know, she's great, but we've just been fighting a lot. You know.
Has the fighting increased recently, or is this something that's been going on throughout the marriage and the relationship?
Well, the fights have really increased since I had to go to that diagnostic center. I was literally sent there, and she was like, "None of this had to happen if you just believe the doctors the first time that they tell you that nothing's wrong." But of course, I don't believe them all the time either. So I had to go to the diagnostic center. She doesn't understand that. I mean, I know I didn't want to go, but at the same time, I knew that I was gonna find something just being there. You know, I had to. It's a diagnostic center. They literally do everything, and she just doesn't get that.
Did they find anything?
No.
So it
They
sounds.
said it was all. They said I was all clear,
So
and I don't feel clear.
you don't feel clear at all.
Mm-mm.
Okay. You said something about your kid. You have a son, daughter.
Yeah, I have a son. He is. He's about 12 now. I think he's mad at me just because he walked in on me checking, and he literally just looked at me, rolled his eyes at me, and said, "What else? What do you have this time?" And that really, I guess, knowing that maybe at some level I did need counseling help and that I need to see someone.
You say over the edge, so have you been feeling just, so how have you been feeling about yourself having to check? It sounds like you've been down about it. You don't want to have to check for you.
Just discouraged, really. That's how I feel. I mean, I'm not depressed. I feel like I'm just always tired. And I'm always just searching for something, like restless. And it's just, nothing's, there's no lumps that are coming up, and I feel like no one believes me, but like the pain is real.
When your son walked in on you checking, how did that make you feel? How did you feel in that moment?
Sad.
Sad.
Just because, like I said, there's like this deeper part of me that's like knows that I need help. And that really helped me realize that. I mean, he looks like me, so like literally seeing that 12-year-old version of myself and then thinking about I was 13 when I had that, when I had my heart condition.
That's absolutely true.
It was like my little self telling my older self, like, you've got a problem.
Wow. That sounds very powerful. That was a very powerful self-realization moment right there. Just your son kind of like as a proxy to you looking back on yourself, especially at that age. So it was powerful enough to kind of motivate you to come here. So you have taken the first step, and hopefully we can get to the bottom of what's been bothering you and how we can help. We can come up with a solution together on how we can get you to start feeling better about yourself and hopefully relieve some of your symptoms as well.
Yeah, I hope so. Just because I just feel like this isn't normal. I shouldn't be searching for anything. I shouldn't. Like, I should be healthy.
Right.
But some part of me just knows I'm not. And I have to search. I have to be proactive. I've got to be like, vigilant about it.
Has your son been diagnosed with any medical problems or anything?
No.
And your wife?
No. She'll just get like frequent headaches, but that's really it.
Well, I do want to talk to you a little bit about your upbringing and a little bit about your family that you came from. So your parents, were any of them have any medical issues, or have they ever had to seek any help from a psychologist or just a doctor, physician? How's the family history, medical history looking?
Well, my dad's side, all heart problems. So
Okay.
that's why I'm always watching what I eat, making sure I avoid anything that's going to mess with my heart. I really try to back off the caffeine, anything that's going to trigger something else, for my heart. I don't need another episode of when I was 13. And then I guess my mom's side had a lot of gastrological issues, so yeah, I'm always super vigilant about that.
Right.
And these pains don't really help because it's only a matter of time before the chance of inheritability from his side or her side just creeps down on me.
Right, so you've been pretty much kind of revolved your whole life and livelihood around your health and the health of others, and trying to make sure that no matter what the likelihood of is in your inheritance, that you're doing what you need to do to try to lessen that. How do you feel about that? Would you say that was kind of an accurate description?
Pretty much.
Do you think you've been successful in that, and kind of preventing, through your lifestyle, preventing the likelihood of getting sick?
I just have to stay hypervigilant. I know that nobody's invincible, so I wouldn't say I've been doing a good job. I've just been doing what I'm supposed to do and just be vigilant and check. And, the media tells you all the time, check for this, check for that, check. So I'm always trying to keep that checklist and really just get through it and check for basically anything that could go wrong, because I feel like I'm running a factory and it's like I need to make sure that everything's in order and that nothing's broken and that everything's working, and that I'm not going to like get just this sickness that's gonna mess with the factory of my body, so to speak.
Does the factory ever shut down?
When I have a cold, yeah, and sometimes too, I feel shut down when I'm off work too. I try to spend time with my kid, and we'll spend some time together on Saturdays and Sundays, but what I really just love to do is just lay around, just rest, because I feel like everything swarms in my head of what happened over the past week, what's coming up next. So I really just like to be in bed and just rest and lay there and try to take my mind off things, but my wife hates that. That's another thing that we fight about. She wants me to get up and do more and enjoy life. She's one of those like, I'm happy about life people, and I'm like, I'm worried about life people.
Would you like to be more happy about life, kind of meet her halfway towards her end, or are you
Part of me wants
comfortable
to.
where you are?
Not comfortable at all. Would be a horrible word to use for me, but some part of me wants to be happy like her. Sort of why I married her, because she was always so upbeat, and I'm just not used to that. Everybody in my family's always been like a worrywart. So it's refreshing to see something, so positive.
So would you like some relief so you can, say, enjoy life more often and spend some more time doing productive and constructive things with your son?
Yeah. I mean, I'm 38, and he's growing up so fast, so I really just want to be able to spend more time with him before he goes off to college, and I want to be able to give him that quality time before something just takes me away.
So you feel like there is a strain in your relationship. And there's beginning to be a strain in your marriage because of the preoccupations that you're dealing with. Is that pretty accurate?
Yeah. I mean, we've always had little tips, because, like I said, she's sunny, I'm rainy, so we'll clash that way, but we've come to respect each other until, like I said, the pains and the checking, she got sick of that pretty fast. She was pretty much done with it. She was like, you need to stop doing this. Because at first, when I started checking, it wasn't an issue. Then, gave it a while, and she was like, she'd give me that look, and then I'd have to go behind her back and do it. So, it became part of my routine. You brush your teeth before you brush your teeth when you wake up, check, get dressed, go.
Have you been sleeping well?
No.
On average, about how many hours of sleep do you get at night?
6.
About 6?
But sometimes even worse when, like I said, sometimes the anxiety will just keep me up. I think I mentioned that before, that sometimes it'll just keep me up and helps me feel like immobilized, that I just feel paralyzed. And sometimes I'll only just get like 4 hours of sleep. And that's really why I just like to lay in bed and just hang out, because then I can catch up on my sleep, and if I can't sleep, then at least I've got the TV, and I can just watch TV and just get my mind off things, and I don't really have to do much.
If you don't mind, I do want to ask a little more personal question.
Okay.
Have you noticed any changes or complaints with your sex life?
Well, we're not as close as we used to be, just because I guess there are some times during intercourse while I'll get anxious, and then I'll get the pains, and then she rolls her eyes at me because she's like, you don't have any pain. I'm like, you need to stop looking for pain. And yeah, it's caused some strain. I'll say it caused some strain. We don't do it as often as we used to.
Would you like to get back? It sounds like you want to get back to at least better than how it used to be, where now the pains is kind of happening while you're having sex, kind of happens when you're trying to sleep, and I know you check while you're at work, but you experience the pains while you're at work too.
Yeah, sometimes.
Have you ever had kind of like a pain episode where you couldn't make it into work, or are you still able to go to work?
I don't think it's ever been that bad.